Welcome, welcome, welcome to Health Issues. I'm your host, Sylvain, and believe me, we're having fun already. I'm excited about this particular program, and you know our love for nutrition and health. And we have two awesome guests from the Pennington Biomedical Research Center in Baton Rouge, and they've come down here to New Orleans. We have Dr. Robert Newton here, and he's going to say more about himself, and also Dr. April Stull, both of them, and I will say that Dr. April Stull's undergrad university was Southern in Baton Rouge, and Dr. Newton, his undergrad was at Hampton. They have a little competition going, but for those who know those universities know that there's two great universities. Dr. Newton, tell us a little bit about yourself.
Well, I'm an assistant professor at at Pennington Biomedical Research Center, and I really study physical activity and health improvement in African Americans. So trying to get African Americans to eat better, to exercise more, to just improve their lifestyles.
Fantastic. Dr. Stull, a little bit about yourself.
I'm an assistant professor at Pennington Biomedical Research Center, and I do a lot of research in the area of diabetes and botanicals, more looking at prevention of diabetes, so that pre-diabetes stage. And botanicals, I do a lot of plant-based research. One of the research projects that I've focused on mainly has been looking at the health benefits of blueberries.
Fantastic. And for those who don't know Pennington is
It's a research center that's in Baton Rouge, and what we're really focusing on is trying to prevent chronic disease. That's really what the focus is. So we have basic scientists, we have population scientists who are all really focused on nutrition and physical activity and trying to solve whatever chronic disease it may be. So diabetes, hypertension, obesity, those sorts of things.
Fantastic, a great resource, and you guys are known all over the world. I mean, the research is published, and for those in the academic circles, I think everybody's familiar with the powerful studies that you guys put out. Before we go anywhere, what is a blueberry and why is it so important?
Oh, blueberries are important because they're this very, very small berry that's very, very powerful. It has all kind of vitamins, minerals, and it also has many great health benefits. Who would have known that the little berry has so many health benefits? I've conducted 2 research studies at Pennington Biomedical, and we've looked at populations that have prediabetes, hypertension, and obese, and we found that the blueberries help improve insulin sensitivity. And when I speak of insulin sensitivity, I'm talking about helping the body to move glucose throughout the body into the cells. And we found that consuming blueberries, this helps improve that process. So this is good for helping to prevent diabetes. And also we found that blueberries improve endothelial function. So endothelial function, this is potentially heart health. Right. This is looking at your blood vessels, the way your blood is flowing throughout your body. So this potentially has heart health improvement. So we found in our 2 studies that blueberries have heart health benefits and also prevention of diabetes. And so this is something that is very important to our community.
Fantastic. Now, botanicals in general, so are there any other botanicals that are powerful also, or is one botanical more powerful than the other?
Well, of course, I'm going to say the blueberry because I study blueberries. So, but actually, they're all berries. All berries contain the same bioactive compound as blueberries. You also have grapes. You also have really. All of your fruits have many different bioactive compounds, but the ones that really stand out are the berries and the grapes because they contain this certain compound that has been studied, that has been shown to have all of these great health benefits.
What compound is that?
The name of the compound is called anthocyanin, and the anthocyanin gives the blueberry its dark color.
Okay, interesting. So. This whole field, how did you get involved in botanicals?
Well, I started out after I graduated from Southern University with my BS in nutrition, and also I'm a registered dietitian. I decided to continue with a career in research because I really wanted to help the community, and I had a real great love for diabetes because I have a family history of diabetes. So it's more so stemmed from a personal interest. And with getting interest in botanicals, I always wanted to know what were the other options other than medication, because a lot of my family members and a lot of people in the community and people that I know, they're so heavily medicated when they're on certain disease, when they have certain diseases, or either when they're trying to prevent a disease. And so I always was just very curious, are there other options out there? And so that's when I became interested in botanicals, trying to search for other options, to give people other options that you can take more control of your health. You can actually go into a drugstore, you can purchase these botanicals, you can read about them. So it's really being more proactive and taking control of your health.
Fantastic. Now, Dr. Newton, the work that you're doing, you're a clinical psychologist, but you're focusing on physical activity. How do those two things connect?
So really what it is that, as a clinical psychologist, we really study how to help people to make behavior changes. Okay. And, a lot of people across the United States, not just African Americans, but all people, don't get enough physical activity. So really, as a clinical psychologist, we're trying to develop strategies that help people to start becoming more physically active and to maintain their physical activity. So, you take basically a theory and you apply that theory to a behavior, and you say, okay, well, according to this theory, these certain things should help the person to increase their physical activity, and those are the kinds of things that we do. That's how we connect the clinical psychology with the behavior.
Does anything work?
A lot of things work to help people to start making behavior change, whether it be helping them start eating blueberries, change their nutrition, or increase their physical activity. Maintenance of behavior change is very difficult because there's so many things in your environment that pull you back to the way that you were eating before or exercising before. So it's a challenge to get people to maintain their behavior change, certainly.
After 6 months or a year and a half, what's the cutoff time usually?
Yeah, you really start to see things change about a year. Yeah, so I mean, you'll see like weight plateau about 6 months, like weight loss will plateau, but then about a year it starts to creep up. And the same thing with physical activity. People will increase their physical activity over the first 6 months, it'll plateau, and then it starts to decline about a year. For most people, not everybody. There's a good number of people who can and who do maintain their physical activity, but for the majority of people, it's very difficult.
For the ones who are successful, what are some of the keys that make them the victors that are able to move forward in victory?
Yeah, I don't think we know all the keys, but I think one of the major things I think that people do is that they make truly a lifestyle change. So they have put it into their schedule that this is something that I'm going to do, and they sort of identify with it. Like, now I'm an exerciser. And so I think by making it a lifestyle change, like something that you're truly incorporating into your personality, into your life, I think that's what really helps people to maintain that lifestyle change.
What about the people that people surround themselves by?
Yeah, social support is important because if you make yourself accountable to people and you tell them, like, this is what I'm doing, then those people are going to come back to you and say, well, how are you doing? They're also going to reward you when you've made change, like, oh, I see you're exercising, oh, it looks like you've lost weight, those sorts of things. So, yeah, social support can be very important for a lot of people. But I think for the majority of people who really make that change and who they stick with it, it's because they themselves have made an intrinsic decision that this is what I'm going to do. And it's really just a part of my schedule. So, some people, you get up and you go to work. That's your schedule. That's what you do. These people put into their schedule, I'm going to exercise. So all things have to be put to the side so that I can exercise. Or it's the same thing with, making that dietary change. They've committed to eating these kinds of foods for a lifetime.
The religion of hard work.
Yes.
Now, Dr. Stull, healthy eating leads to a healthier individual that is more apt to want to exercise and do the right thing. Am I correct? There's some things that go on in the body where healthy people are better able to make healthy choices.
Correct. Healthy eating goes along with exercising. For example, when you eat healthy, usually you tend to want to exercise. And then people that exercise, they also, it's been, studies that have shown that they also have better quality of sleep. Better quality of sleep, along with exercising and eating healthy, leads to more energy, being just more energetic, being a better person. So like as Dr. Newton said, it's all about that lifestyle change. I really think that you need both. You need to have the dietary change, and you also need to increase the physical activity. You really want that holistic change.
Holistic. And the belly fat, though, is what people are trying to get rid of. They're all right with this upper fat and this, but it's the shape. Is it more the shape or the weight? It's more so that we actually have a study going on currently at Pennington looking at pear versus apple in women. And there has been evidence that people that carry their weight in the midsection, that they tend to have a higher risk of certain diseases versus those that carry the weight lower, like in their thighs. So yes, that can be very important, but I like to tell people that you shouldn't really focus too much on where is the fat distribution so much as I need to change my lifestyle. So you need to change the lifestyle. You need to improve your eating habits, incorporate more healthy eating, snacks. Like I think that's the largest thing to improve is eating those healthy snacks. So I really think you should focus more on just becoming a healthier individual, more so than just the current weight that you're at. Now, New York is a place where the Gestapo has come in to throw the big gulp soft drinks out and those things, but that didn't go too well in New York. Am I correct?
I'm not as familiar with that research probably as what I should be. But, that whole research literature on the sweet and sugary beverages, to some extent is controversial because, if you look at epidemiological studies, they will suggest that the people who consume more of these sweet and sugary beverages end up being more overweight. When you do interventions to reduce those things, we haven't always seen that it results in weight loss. So that research is a little bit controversial at this time.
Yeah, because I think it was Tim Farley that came out of Tulane. He ended up being the head of public health or whatever, something in New York, and he went that way. But are there any good and bad foods? Are all foods good, and dependent upon the moderation thing? Because if blueberries are good and if grapes are good, all right, then does that mean that popsicles and soft drinks are bad?
You know what? I really like to encourage people to get rid of that good and bad foods. Because people, when you say this is a bad food, you punish yourself when you actually consume those foods. But we will say healthier choices would be those foods such as your fruits, your vegetables, your low-calorie foods, eating, snacks such as like your nuts, your yogurts, your blueberry smoothies. And, your fattier foods are going to be like your anything that's fried. Your potato chips, all of the things that we consider so yummy. But I wouldn't necessarily focus on things as being bad. I like to tell people, to eat things in moderation and try to incorporate more of the healthier foods than the foods that are not as healthy.
Yeah, I think the smoothie thing is a little controversial too, though, whether they're kind of act more like a soft drink than a fruit. But this idea, though, of guilt, is that what really goes on, that people just get guilty and give up when they feel they've failed? Yeah,
they do. A large part of what we do in behavioral studies is to combat people's thought processes, because people do feel like if they go off their diet and these strict rules that they've made, and they have like, a dessert or something, they feel like they failed at their diet, which then causes a cascade of other behaviors and feelings that leads them down the road of going back to eating the way that they were.
Right.
So yeah, we spend a lot of time combating those negative thoughts that then turn into negative behaviors, and realizing that if you go off your diet or your lifestyle change, it doesn't mean you failed. It just means that you had something that maybe you didn't want to have. But that doesn't mean that you can't recover and the next meal, the next day, get back to the way that you wanted to eat. So yeah, that is a major part of the things that we do when we help people to try to lose weight and to make behavior change.
Just don't feel guilty. Just get back up and push again. But diabetes is a special one in that diabetes is so directly related to what we eat and the level of exercise that if people don't stay on a program, then the blood sugar keeps going higher and higher. That's what you found. I mean, you even looked at it with your family and so forth. How did that work out after you got the Ph.D.? Did they listen?
Correct. Of course not.
I mean, but you have a PhD, they're supposed to say,
well,
okay,
that doesn't matter with family. They still look at you as little April. Go shut up and sit in the corner. But no, seriously, I think now I have gained much more respect now that I have, published data and, there's been written documents about the research that the results that I've found at Pennington. So I think that they are finally listening to me. Okay. But yes, the people that have diabetes, yes, they are on a stricter diet. Okay. And I know a lot of times people with diabetes, they get a little confused because a lot of times they're thinking, oh, should I consume sugar? Should I not consume sugar? But the thing is, you can consume sugar, but not to the same extent as a person with normal glucose blood sugar levels. Right. So everything has to be monitored and controlled. And also people with diabetes, they also have to realize that fruits are great. They taste great. They're healthy. They have many health benefits, but they also have a natural sugar. So really, a lot of things that they eat, they have to factor in that a lot of foods have some type of sugar in them, and just monitor and consume things in moderation. And also they need to have a team of people that can help out with this, such as making sure you're talking to your doctor, talking to a registered dietitian, someone that can help guide this diet.
Yeah, but I think that there's so much misinformation because everybody's a food expert. I mean, correct. Anybody you talk to, if you find a drunk on the street, he's going to tell you what to eat.
Correct. You're absolutely correct. Everyone is a nutritionist, and I think that that's the problem that we have today, is that a lot of people don't realize that you have registered dietitians that have actually gone through the training and actually taken exams that are certified to actually give nutrition information, correct nutrition information to those that, like you're saying, that have diabetes. And those are the ones, when you have diabetes, you need to go see a registered dietitian.
I mean, that's a good thing, but as far as for access, where, out of the millions of people out there, it's not that many of you guys. Correct. And very few people have access to reach them, and they eat every day. So how do people find good information?
Oh, well, Pennington Biomedical Research Center, we actually provide a lot of health information on our website. We have information in talking about diabetes, prediabetes, obesity, hypertension, cardiovascular disease, and they give detailed information about those different diseases. They also tell you the signs and symptoms. They also have diet plans. We have recipes. So going to our website, www.pbrc.edu, we have a lot of information out there for the community. And we also do a lot of community events. At Pennington Biomedical Research Center, we have a botanical research center. And in this botanical research center, we research many different plant-derived supplements. So far, we've looked at, of course, blueberries, fenugreek. We looked at artemisia, We've looked at bitter melon. So we're looking at all, and also many different plants that are native to Louisiana, which is very beneficial to this community. And we have community presentations. So there are many different opportunities that the community has if they don't have access to other people in the medical arena. You can go to places like Pennington Biomedical Research Center and obtain health information.
That's good. And Dr. Newton, you guys had a play day. Y'all, what do you call that? A play program?
Play Streets, yeah.
Play Street.
Yeah. So, that idea really came about when you think about that not everybody kind of exists in the same environment in terms of their ability to do physical activity. So some people exist in environments that have streets, that have parks, that have a lot of open space. And then you have other people who exist in environments where the streets aren't safe, where they're dilapidated, where the parks are not kept up, okay? And they may be even in high crime areas. And so really what the play streets is, it's where you close off the street to motorized traffic. Okay. And you organize with the neighborhood, and you just provide opportunities for children to play for a couple of hours, okay? So in the play streets that we did, we went to environments that were lower SES, that didn't have parks nearby, or that the parks were, not well taken care of. And we essentially worked with the neighborhood. Like, we went to the neighborhood and said, hey, this is what we would like to do. We would like to have an event for your neighborhood. And they agreed. They said that it would be a good idea because they recognized some of the barriers that were in their environment that were preventing the children from playing more regularly. And so we coordinated with the neighborhood. We had to get the city involved in terms of the police, because they have to be there to actually block off the streets and barricades, and you have to get your city planners involved, your transportation department, a whole bunch of different people have to come into play. But most importantly, the neighborhood, because the neighborhood really provides ideas for what the children could do. I mean, it's their children. They know what the children like to do. And so we had a recreation department become involved also. And we just had days where, for 4 hours, we had activities for the kids to do. We had open space, we had equipment, and the kids just kind of came out and played. And their parents got involved. We had, the police who came out and got involved, like not just sitting at the barricades, but actually coming out and actually, being physically active with the children. So, we had, over the summer, we had 6 different play streets that took place.
I'm sure the kids had a ball.
They did. They had a great time. We gave out surveys to ask people if they liked it and what they thought of it, and virtually everybody, liked the play streets and enjoyed it, and the children had just a wonderful time.
That's fantastic. So currently, you're doing studies on blueberries right now.
Correct.
Right? That's any research you're working on right at this time?
Oh yeah. So we have we're just finishing up an exercise training program that we did for African American men. So
wait, say that again.
An exercise training program for African American men.
Why African American men?
Because African American men really are under-researched. So they don't participate in research at the rate that, say, African American women do, or Caucasian men or women do. And so we really don't know all the benefits that African American men could get by doing the studies because they're not in the studies. So what we decided to do was we decided to do an exercise training program that is very consistent with what the government recommends that we do for physical activity, which is 150 minutes of physical activity a week, of aerobic activity at moderate intensity levels, and then strength training. So we had them do 2 days of strength training. And we work with the Y, so again, we're back into the community. And we had these men exercise for 20 weeks, and then we had another group that didn't exercise. And so we're just now getting to the point where we can compare the results. In this study, similar to what Dr. Stull does, is looking at diabetes prevention. So by doing this study, do we reduce the risk factors for African American men to developing diabetes? Okay, so we looked at their insulin. How does their body handling the sugar? Does it handle it better after the intervention versus before? Does their body fat go down? Does their weight go down? These sorts of things that we're looking at in that study. We also have a church-based study that we're going to be starting, where essentially we've got agreements with 9 different churches in the Baton Rouge area to do a weight loss program. Okay, so what Pennington is going to do is we are going to train people within the church to deliver the weight loss program to their church members. So in that way, that program will be very sustainable. So you don't need Pennington to be there, you know, on a day-to-day basis, on a month-to-month basis. We train the individuals in the church. They deliver an intervention, and they're free to deliver it to however many people that they want to within their church.
And so, you know, weight loss is, once the person has the knowledge, if it's good knowledge, I mean, they can teach anybody. I mean, lay people can teach anybody, because if it's solid, then it's correct.
Yeah, and that model of using a lay health worker or community health coach, however you want to refer to it, people who don't necessarily have, like, you know, a Ph.D. in nutrition or, you know, clinical psychology or something like that, we can train other people to deliver these interventions. This model has been used in church-based interventions before and in other interventions that are based out into the community. We just haven't done too many of them in Baton Rouge, and so we're, you know, trying to test this out and trying to, you know, really get it instilled within many different churches within Baton Rouge.
What I hear, though, is that you guys are, you know, two African-American Ph.D.s from HBCUs, I have to say, you know, Hampton and Southern, who are so dedicated to the community. And it's amazing. Usually when you think about Ph.D.s, you know, people that have no connection just sitting in a lab, but you guys seem to be driven to taking the work from the bench to bring it out to the people.
Yeah, that's very important. I mean, if all we do is put our research in journals, it doesn't make a difference, you know? And so I'm really driven to make a difference, you know, in community-wide to a large number of people, because if all I do is publish and somebody says, oh, nice research study, that doesn't help somebody like you. It doesn't help somebody, you know, in Baton Rouge who needs to exercise and who wants to exercise. You know, that doesn't really do any good. So yeah, that's why, you know, I tend to do more community-based studies so that we can have a broader impact, because that's what we're trying to do. We're trying to affect people, you know, on a large scale.
That is fantastic. And have you been able to get back to Southern at all?
Oh, I go to Southern at least once or twice a year. I go and give a lecture, often at Southern University. I'm on several committees at Southern University, so I'm very dedicated and loyal to Southern University.
I see you as a SU fan.
Yes, I am.
And you attend the Bayou Classic.
Yes.
That is fantastic. It really is. It's critical because, you know, disease knows no race, all right, per se. But the African American community is, whether it's underserved or not, the statistics are staggering, and it's almost like a third world country in Baton Rouge and New Orleans.
Yeah, and there's a lot of things that contribute to that. So clearly behavior change makes a difference. So, you know, African Americans tend to consume more fat, less fruits, less vegetables. And you listen to what Dr. Stull says, just the opposite is what we need to be doing. There's a lot of research out there that says that African Americans, as well as other groups from other ethnic groups, just don't exercise enough. Okay, when you put those two things together, you have a problem.
Hey, health issues. Hey, I'm excited. Look, work as hard as you can. Fight as hard as you can. Continue to support things that are uniquely ours. And believe me, you are worth something. And continue to care about who you are. Thank you so much. Appreciate it.